Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast, episode 45. And today, some more clinical care tips and some more rules from a very wise doctor, one of my favorite doctors in fellowship, Dr. Bob Hickey, who I am hoping to interview in future episode. I'm going to get you, Bob. And those are some rules that Dr. Bob Hickey taught me during fellowship. All of them have served me well, and I try to live by them. And let's get started. Rule number 104. Treat the patient, not the screen. So Dr. Bob Hickey told me that he never does a chart biopsy, aka look at the chart, prior to seeing a patient. He thinks it leads to anchoring bias, and for the most part, he can get all the information he needs from the family, from the patient, etc. It gives him more time with the patient and with the family, and if he needs any more information after the initial history, he goes back to the electronic medical record and gets the details that he needs. Personally, I think that is a very great point. Anchoring bias is a challenge for us physicians, certainly challenge for us emergency physicians, so I can certainly see how looking in the chart ahead of time, which might give you some valuable information, can also lead you to anchoring bias and lead to some mistakes. I can certainly see the point of going in the room with an open mind as opposed to reading through the chart of a child who's had history of constipation and has been to the emergency department for it, coming in with yet another episode of abdominal pain and anchoring on that constipation because you looked at the chart and saw the history. So perhaps going with an open mind is the best in order to avoid anchoring bias. Good point, and certainly something to think about. I must say, as much as I admire Dr. Bob Hickey, and I certainly agree with that rule, I can certainly see the opposing argument about knowing some information about the patient. Assuming you are able to from the electronic medical record, a good ER doctor is always ready, be a step ahead, that's rule number 39. So I can make the argument that reading about the patient and know past medical history, prior complications or issues the patient has had can help you with the patient management. So probably two good arguments for and against reading through the patient chart before you actually go into the room. Think about it. Be aware of the advantages and the disadvantages of both and think what is right for you. Certainly, anchoring bias is something that we should all try to avoid. And clearly, there's no right answer. My personal approach to this issue is with kids that are just average, healthy kids who've been to the ER maybe once or twice before and have no medical problems or no significant past medical history. I go in there with an open mind. However, for the kids who come with DMS from chronic facilities, have serious, significant comorbidities and take many medications, I try to look at the chart before going into the room simply because there's so much to know. Rule number 105. Getting unnecessary lab tests is like picking your nose in public. What are you going to do when you find something? So when I read through that rule and when I think about it, it really demonstrates Dr. Bob Hickey's personality and humor. I think this goes back to the experience many of us has had as physicians, especially emergency physicians. How many times did you order a test that was not really indicated, for example, complete blood count on just another patient with a fever, and got scared by the results? Maybe even change your management based on those results. For example, some significant leukocytosis, left shift, or bendemia, when the child in front of you really looks okay and nothing has changed. How many times did you find an insignificant, incidental finding and got the parent even more worried about their child and perhaps send them to some specialist who can do nothing about it? So remember rule number 105. Getting unnecessary lab tests is like picking your nose in public. What are you going to do if you find something? Rule number 106. Over-reliance on experience leads you to making the same mistakes with increasing confidence. So this is a rule Bob told me about recently. I don't remember him mentioning it during fellowship or during our shifts together, but I couldn't agree more. This quote is all about the experience and making mistakes. It's the idea that just because we do it this way doesn't mean it's the best way or even the right way. We should always be open-minded to the limits of our own knowledge and our own biases. Hence the importance of research, which Dr. Bob Hickey has dedicated a significant amount of time out of his career for. We can talk about that some other time. But Bob always says he has no problems making decisions in the emergency department, but he tries to stay open to the possibility that he is wrong and possibly the teaching that he got was incorrect. He always tries to be open-minded. For me, this rule is one of the reasons I only looked for an academic position when I finished fellowship. I think being an attending who is responsible for the education of physician assistant students, medical students, and residents from certain programs helps me keep an open mind and certainly keeps my drive to improve, question what I do, and see if I can do things better. This is why I also recommend to all my students and residents to seek academic opportunities when you get the opportunity to teach while seeing patients and practicing medicine. So that is it for today, guys. Thank you again for listening. Let's review what we learned from the wisdom of Dr. Bob Hickey. Rule number 104. Treat the patient, not the screen. Yes, you can look at the chart before going into the room, but understand that this can lead to some biases. Perhaps it's better going into the room with an open mind and have a good conversation with the parent so you can get all the information you need. Rule number 105. Getting unnecessary lab tests is like picking your nose in public. What are you going to do if you find something? Think about it before you order that CBC or those blood results that really do not help you find out what the patient has, or even rule out any serious conditions. Get the tests that give you an answer, and the answer changes the management. Rule number 106. Over-reliance on experience leads you to making the same mistakes with increasing confidence. Always a good idea to question yourself and ask if what you're doing is the best way. Are there other ways? Is there something new to learn? Keeping in mind that we are all PGY forever. And that is it for today, guys. Thank you very much for listening. I hope you like the rules. I hope we can get Dr. Bob Hickey to come on the show as a guest in the future. There's a lot to learn from this guy. The next outro is dedicated to my favorite Bon Jovi fan. He might be 12 years old, but he really likes good music. Hope you like it. Have a good day, guys.